Hello, everyone. Before we start today, I just want to acknowledge, with respect to Indigenous peoples and the communities whose historical relationships with the land continue to this day and whose traditional territories our work takes place. While we meet today on a virtual platform, I think we can all take a moment to acknowledge the importance of these lands, which we all call home. And my name is Armand. I'm the project assistant with the Canadian Coalition for Green Healthcare. And on behalf of the coalition, I would love to welcome all of you today to the Cut the Carbon Beyond the OR session, Land-Based and Nature-Informed Healing in Practice. Throughout the event, you can use the chat function if you have any technical issues that you may be experiencing, and use the Q&A function if you have any questions regarding the presentation. And our panelists will be answering these questions towards the end of the session today. We'll also be recording this presentation, which will be sent to all the registrants and will be available on our website and YouTube channel at a later time. So, before further ado, presenting today is Dr. Anna Guns and Nicole Yanni. Dr. Guns is a pediatric intensivist, founding medical director of the Children's Environmental Health Clinic Ontario, co-lead of the land-based healing Nature for Healing program at the Children's Hospital, LHSC, and associate professor at the Schulich School of Medicine and Dentistry at Western University. And Nicole Yanni is an Anishinaabeg Saulteaux of the Fishing Lake Nation. She is a community member first and passionate in the field of mental health for Indigenous peoples. Nicole is an Indigenous mental health provider with the Nundawasin and Nojimo and bridges Indigenous ways of knowing and professional experience to support holistic and cultural wellness. Nicole is co-lead of the Nature for Healing Land-Based Healing Initiative with Dr. Anna Guns. And without further ado, I will pass it on to Dr. Anna Guns.
Hi, everyone. I'm just going to share these slides quickly. And Nicole couldn't be here to present, so we usually talk together. But she did record two slides, but you're going to hear a lot less of her voice than I usually like for that reason. She's actually up on the land. She's working with schools, children in schools in some communities in northwestern Ontario, doing land-based healing work. It's beautiful, beautiful work. So she's a really good excuse. So thank you. I really appreciate being here. In terms of disclosures, no real disclosures other than some grant funding. And all the work I do is like many of you, just because I care so much and this is my work. But my true disclosure is about who I am. On the left, that's my mum and my grandma, who was a servant in the great houses. She left school as early as it was legal in order to work there. So she was a big influence in who I am and the work I do today. She was grounded very much in this concept of we are all human and all the same. And so when later on my family are really, they were farmers, and when a lord would come by the house and he'd put his head down and say, "Oh yes, Lord," blah blah blah, she'd elbow him and go, "Look in his eyes, he's just a person." And then on the right is my other grandmother, who was an incredible woman. And my father, who ended up growing up in New Zealand after being born in the war of German Jews. So that explains my last name. And he as well, every time big issues grew in the world, he would always get me to watch. I remember as a child sitting there watching Nelson Mandela come out of jail, and he'd said, "Sit and watch this. This is important." And I always had this question. I don't understand, why didn't people say this? Why didn't people say anything? Why didn't people say anything with many of the big humanitarian events that I learned about in my lifetime? And even this concept of colonization that even happened after the war. And he would say it's complicated. And as a child, I didn't understand that. And as an adult, I understood what he meant. But I still have the same question. And so that comes to, this is a picture of the land I live on. This is a native flower meadow that we have been cultivating over the last number of years. And so much of this work, the land I live on is of the Anishinaabe, Attawandarunk, and Mississauga peoples. And this relationship that I'm growing with the land that I now live on as a settler, as an immigrant. And the friends and collaborators and knowledge keepers and experts who've shaped really my journey over at least a decade that I continue on to really understand what decolonization means and what part we play in it. They've been all phenomenally grounding in this, and the seven generations principle, which pertains to the peoples in the land that I live on. I've often heard many people say, especially around sustainability talks, and when I reflect on that myself, and in this work as a Southern, how I integrate it, I really uh, think I really realize how important the seven generations past were, particularly around the way we think about work, the way we think about health, the way health isn't achieved equally across peoples and nations, and so on and so forth, and how we treat the environment. And that's actually going to be one of the themes that I want to integrate in today. So I know cut the carbon is usually very pragmatic. And I think what I want to get at is, the journey that I've gone on over the last decade, because despite many things being pragmatic, there's very many barriers. And I think what I've come to understand is how all these things can intertwine and really help shift and move things forward in a more meaningful way. So with all that being said, I'm going to start with, so I'm going to use Slido through this. So feel free to scan that QR code. And I'm just going to ask you, where is home? So if you could join us and we can see where everybody is today. So it might be where you're living now. It might be somewhere else. It might be a place. It might be abstract. Okay, good. It is working. Oh, we have some southern, we have some east, a lot of eastern and central. Innu, Burnaby. Now we're really starting to span Turtle Island. Very beautiful. Thank you, everyone. This is um and we have another London back. Nova Scotia. Thank you guys. Thank you. Okay. All right. So now that you have that there, and you can always keep going with answer it. There will be some more of these Slidos coming. If I can advance my slides. Okay. Next question is, when you picture paradise, what do you see? Police, clear water, sunlight. You know what? It's interesting. I think I've done this so many times and I've never seen peace, but that's a really beautiful answer. Children running and playing. Yeah. So as a pediatrician as well, I heavily endorse that. No more. Yeah. Birds, family, ocean, palm trees, nature. And it's interesting. A lot of I've done this many times in many different forums, including people who don't really have anything to do with um, sustainability or planetary health or anything in general. And unequivocally, like 95, 99% of the time, all of these things are related to nature, right? In some extent, and family, but a lot of it really does have to do with images or areas around nature. And so in that theme, because this is what we're going to be talking about a little bit, I do want to give you, I understand that you are likely all extremely busy people and running from one thing to another, but I just want to give you a moment to yourselves and that will help you hopefully engage in with us today as a community. So I'm just going to invite you to close your eyes if you feel comfortable. If not, just fix a point in front of you. and have your feet connecting with the ground and your back tall, like a tall tree. And really feel through your feet and feel the roots that are extending below them into the ground, connecting to where you are now, your home, whether that's under your feet or somewhere else, to your family and to each other. And just take a moment or two to just focus on your breathing. You don't have to do anything different. You know how to breathe. And if your mind wanders or goes a thousand different places, just refocus on your breathing. And I just invite you to just take a few moments and a few breaths to yourself. And when you are ready, I invite you to bat your eyes open. I know that's a short period of time. And then just know, oh, I usually notice how you're feeling. Um, and if you can just share one word about how you're feeling today, so we can have, there's no wrong answers, there's no right answers, just connecting as well on that level. And I'm going to say weary is how I feel. A little bit worn and weary. I'm tired, yeah, relaxed, curious, quiet, interested, soft. Soft, I love that word. Yeah, lots of tired, worried, frustrated. Oh gosh, frustrated. That's also, I think, why I'm feeling a bit weary. It's been a frustrating, weary day. Hmm. Wondering, peaceful. Yeah, a whole mixture of words and feelings as we go here. So I invite all of these emotions here today. And I think this is part of the piece around what, from at least from an, especially an English perspective and like a Western perspective, we don't often integrate these feelings into our thoughts, even though if you participate in education, we all know how interconnected things are. You can't do work if you're not in a state or an environment that feels safe, and you can and honor this. But I'm going to go through that now. Now I'm going to ask you why you joined healthcare. Maybe you're not directly involved in healthcare, but whether it's health of the earth or planet or community, what was the reason? Like, what's your underlying driving value that keeps you going, even if you're frustrated or tired, um, or angry or sad or worried? Why did you initially start on this path? Support well-being across many boundaries. Meaningful work, animals, nature, to help people, helping people live healthier lives. To become a pediatrician, woohoo! To become a doctor, challenges, um, contributing to human value. I love that. Educate others, meaningful work. Yeah, and I think help, way, life, impacting challenges, positive. I think, and again, this is. I hope that this will come um, in many different ways back as we do this. But I also do wonder, at least for myself, it's not something that, and I work with a lot of different health disciplines, as well as obviously residents and pediatric residents and medical students. I don't think we always reflect on our values um, and question that, and as we move forward as well. So I'm going to keep moving as well, and all these will all come back. But what am I going to talk about today? So I first of all want to talk about the mind-body environment connection and the ecological model of health. A slightly different framing, heavily influenced by an Indigenous planetary health world-renowned expert, Nicole Redvers. Sorry, I work with a lot of Nicoles, who's a Dene woman, an incredible human being. And the reason for this, and it has to do with work in sustainability. So I've been doing a lot of work. I started out as a geographer. I ended up in pediatric ICU, but I've been working in the climate adaptation, mitigation, sustainability world for some time now, right? Ever since my practice. Um, and then and then I want to talk about, if it's helpful, this program that we've co-created with, many, many different people around the country and where I am, which is our Land-Based Healing Nature for Healing program, and how it can be used to support physical, mental, spiritual, and emotional well-being in a healthcare context of colleagues, and also to do this work, and how what we've heard even from some of our partners is that how nurturing this relationship with land and with nature, especially for those of us who grew up in a Western context, might actually help with efforts for decolonization from a real conceptual understanding perspective and grow culture change. And so this is where I again, you heard my background. This is me as an English person, an immigrant in Canada, a Western perspective. And I think a lot of this realistically I think for those of us who have a colonial state of mind or how we grew up in this culture, it's essentially how I have ended up connecting and understanding in some way at a fundamental level what my Indigenous partners and friends and the experts and knowledge keepers that I've been honored to talk with, a frame of mind that is potentially much closer to that. So we have this web of understanding, even though obviously growing up in different paradigms, they could never be the same. But I wonder if, at least what I found from colleagues and people otherwise, it has been a helpful framework for me that allows a much more holistic understanding of health and has only helped us in our efforts in our hospital, and I'm very curious about. So I also would love to hear your feedback. So I'm going to start with a story. This is actually my son. It's not the child in question a long time ago, but this boy, I'm going to call him Denver. And he was a premature baby initially. And I met him when he was in his second year of life. And that was probably my first year of residency. And he was actually he did really, really well. But the problem is that he had a piece of medical equipment that meant that he needed to have a very safe environment when he went home with a lot of monitoring. And he had a single mother with a lot of struggles from a social perspective and economic and support perspective, who also didn't live in the same city as the hospital. And so every time it felt like she got trained up and was ready to go, something in her life would fall apart. And so she wouldn't be able to have him home with her. So then she would work with Child Protective Services, and they'd find a foster family who'd be willing to get trained for this piece of equipment, and they get all trained up. And then thankfully her life would change and he would be able to go home with her. So then she would start the retraining process. This went on for pretty much 3 years. And just before his third birthday, though, he was ready to go home with his mom. The day before, one of our respiratory therapists that worked there put him in a red wagon, loaded him up, and took him outside. And he went bananas. Like, he got out of it, and the RT said that he would go and he was looking for things, and he would pick little blades of grass and pick up little sticks, and he was choosing them, and little rocks, and he put them each in his wagon. And then when he was done, he was brought back inside. And he, as you can imagine, everybody there was his family at this point. And the wall was really a window. And he would often play with everybody through the window in general. And at this point, he knew he was going home, whatever that meant. And so he would point to different people and he'd say, "You come here." And he'd go through his wagon and he'd give him a gift, which was he'd choose a blade of glass or a rock or a stick, etc. And so he went through all of this until all the people he could see and he would grown to love and loved him had a present. And somewhere in the midst of all of this, my friend realized, who was watching this, he'd never been outside, ever. So he was almost 3 years old, but most of his life he was actually healthy. It was just a social circumstance that kept him in hospital. And if you think about, he had family, he had doctors, he had nurses, he had respiratory therapists, he had child life specialists, he had social workers, child life people, his family, so many different professions, so many different people, and not one of us had thought about going outside. So this was a very, very fundamental part of occurrence to me, and shaped certainly how I thought about the outside and nature, although remained ignorant for many years to some extent about the importance of it. And again, this is the land I grew up in. You saw our meadow. This is how it started as we were lucky to move here. So pivoting somewhat now is, what's your area of focus? So, or areas of focus. So if you work in health or healthcare sustainability, is there a particular initiative? If you work outside in the NGO, what is the area that you're working on? So state sustainability at large. Is there any other aspect of that? Is it food security? Is it anti-racism? Is it, procurement? Is it mitigation? transport as in tropical medicine, social medicine, infectious disease, pediatrics, global health. Okay, a lot of these things, plant-based food. Um, Perfect. Okay, and general sustainability. Okay, research safety, food waste, natural environments, med ed, mitigation and education resources, One Health, circular economy, nonprofit. Fantastic. Okay, thank you. And I see more people answering, and I will go back and look. So please continue. Interior designs. I love that. Sustainability. I am going to go back and look. So please continue to do this. I'm smiling as I see this. Okay. So when you're doing this work, I think ultimately the model that we use in planetary health, right, is this basic understanding that we have climate change and environmental issues. These have health effects. There are health effects. We have a response, which is our systems and clinicians. And then this has sometimes an indirect or a direct effect in terms of greenhouse gas and environmental impact. And so some people work in the mitigation area, linking across sectors, and some of us in adaptation, which is, how do we deal with these health effects, which is a big part of my work, which I'm not going to be talking about today. At the end of the day, though, a lot of the time this is very indirect. And for those of you who do med ed and other things, and certainly how I trained, this was not part of the conversation. I was lucky. I did a geography degree. I came in, I went through medicine feeling like my arm was chopped off because I was missing this whole world. And then as I started practice and settled, that's when I had the opportunity to lean in. But it's always an added thing. You talk about planetary health, everyone's like, oh, it's another thing. I'm going to do this sustainability initiative. Some places are really active and get it. Other places, it's seen as kind of like a different thing, a different add-on. And it's not integrated. And I think the reason is overall, we haven't integrated that concept of the environment in our lens. So if you're not looking for the environment, you're not seeing it. And for those, it feels like an add-on. It's essentially not. Most of the things we do or care about from a health promotion, whether it's health equity, social determinants, or even sustainability, like QI, the work you're doing in the hospital, the majority of it, if you add the green lens, you're just going to add another rationale about why it's important. There are very few exceptions where it might be a completely different line. So I realize we're going through this, and I think I'm going to ask you to reflect on this, and please feel free to answer. But with the work that you're doing, I'm sure there was barriers of facilities, if you can share, and if you could take the time to answer. I just want to move forward. Time is a huge one, but I want to be able to address some of this, and we'll be able to share this later. And I will share some of the barriers and facilitators too. Infection control, very interesting. And so yes. And so what I'm going to talk about today, there's other times that we talk about a lot of these programs that we're doing and challenging across these barriers and leveraging motion across this. But all of these things I want to bring up here, funding. Okay. So first of all, barriers in terms of the planetary health co-benefit. So Nicole Redford talks about planetary health prescribing, which is essentially what I was talking about, is using your green lens. This is a pragmatic way to say, essentially we're not just prescribing for one thing. If you think about when you come to work, how you come to work, how your patients come to work, when you're seeing them, the differential diagnosis, your management plans, and so on and so forth, purchasing, procurement, waste, all of that is basically integrating a green lens into it. And there are a lot of, I'm sure, themes here in terms of the barriers and facilitators that you have recognized, right? We have difficulty in creating change in planetary health or change in general, resource barriers, dialogue culture, overburdened physicians and healthcare systems, and et cetera, and patient opportunity. We did a study a few years ago, which of course we haven't published yet because that's part of the complexities that I've had in my life. And we essentially asked CEOs and executives and then to pass it on. And we intentionally started with the CEO. So Miles Sargent, Culture, Food, Green, Healthcare was a big part of this. Let's start with the executive officers and ask them to pass it on if they don't know. And we asked them one question about the different 8 domains that the Peach put forward in terms of what sustainability is. And there was a number of different responses, and including from different hospital groups. So basically we had general teaching hospitals. We said it was a group A. B was larger hospitals over 100 beds, and then less than 100 beds. And so we had a pretty equal distribution of people from all across the province. In terms of barriers that people said were issues, including size and institutional focus. So yeah, I'm a small hospital. We have few HR resources. This just adds more burden or stress. People wear multiple hats. One person was actually saying that they were trying to design a new hospital, and the lack of mandated guidelines from the ministry, et cetera, was a huge barrier. Strategic priorities, enablers. So if you have it in a strategic priority, all of a sudden it opens up a lot of opportunity as well as leadership. The leaders are the main facilitators. And what we actually found here across all of these domains is exactly what I thought, what I predicted from my experience. My hospital is extremely hard to work in. I have and my colleagues, and there's amazing willing facilities who've led the green team for decades. People have been frustrated, people have been left. It's really hard to change. Why? We have a green team, but it's not a strategic priority. The leadership isn't on board. They don't understand the importance of it, despite advocacy from their lens. And so what we found out here essentially is that just having a green team doesn't actually translate into change across the different domains. We also did in terms of this also like are people into this? So a few years ago, we had a survey for about 2 years, and each year we had almost 200 participants, and we had a whole range of people replying from across domains. And the vast majority, so this is the early pandemic when people were completely tired of doing surveys, and this is just our children's hospital. But the vast majority said it was very or extremely important that that our environmental performance at our hospital would affect patients' well-being and their satisfaction. So you can see over 2/3 or 3/4, and it would affect staff, physician, and physician well-being and satisfaction. And I will say I had been doing sustainability work around there, but it hadn't really been at the hospital level yet. And so this is what people intuitively said. And I can tell you from, walking around doing all these different initiatives, people look stressed. And when you say, oh, do you have a minute to talk about the environment? And we talk about these different things. People will go, busy nurses will put shoulders down, exhale. Oh my gosh, I'm so glad we're doing this. I live my life one day, I come to work and I feel another. So there is this motivation. People think it's important and we should be doing this. And then on top of that, when we ask them about affecting the reputation of the hospital, where the 90% of people would say that. People thought like this is really important. And when you introduce people, we're like, yes, let's do it. But yet, despite a whole bunch of things, and honestly, some of these are just photos that I put in to reflect it, is like despite so many different things that we did, it's so hard to move things forward and stick. And yes, some of the leadership is there. But at the end of the day, there's something about like, what is it? And like doing adaptation work, what is it that like we can't fundamentally, it's just seen as, oh yeah, and another thing, right? Despite the fact that, you know, these things save money, like I have a picture of a room without paper on it because that was one thing. There's exam papers. We still had that. And our colleagues wanted to do a big QI thing and ask people about how they felt about removing exam paper. And I just had a temper tantrum and I was like, just remove it. We can't follow these processes all the time. And we did, and people, talk to us about, oh, well, then we'll have to wipe down the beds, et cetera. It's like, well, you have to do that anyway. It doesn't actually do anything from an infection control perspective. And boom, it's amazing how maybe 3 people got their knickers in a twist, to use maybe an inappropriate reaction. And then the rest of it, it was fine. It was done. Right. But why is it so hard? And and this is where I'm going to get into the crux of what I'm saying. But before I do, so this is a quote from a 14-year-old girl. Well, she was at the time, my colleague's daughter, before she gave a talk on climate change. She said, what do you think? And she said, Mom, you grew up being told you could do anything. We're growing up being told the world is on fire. So I'm grounding the rest of this in this piece, in this feeling. Why can't we? We might feel that way, and then we come to work, and it might not be in our vantage point, at least for your colleagues. So what do you think about that? Now, what I have come to understand, this is where I talk about the mind-body-environment connection. And I want to ground us into the ecological model of health, which has irked me for some time. So the ecological model, And so before I do that, though, I think part of the problem, right, is when we think of our parent health, especially for physicians, this is how we're taught. X causes Y, right? So one of the fundamental ways that we train is X causes Y. People come in with a bunch of symptoms or feelings or something or experiences, and we ask them history questions, we do a physical exam, we go to some labs, we do some tests, and we hope to come up with a diagnosis, an answer, and then we can figure out a treatment strategy. When we can't get an answer, it's really uncomfortable for us. I know that everybody's experienced that, and you may have also in your personal life, and for those of you who are clinicians, or people in your own life, there are so many times that I'm sure you've all seen someone and you finally give them a diagnosis and it's a terrible one. And despite that, they're like, you know what, and they're relieved. And this articulate this difference between like, I know it's terrible, but I'm just so relieved to know what's going on. We're very uncomfortable with that certainty. from an environmental and a health perspective in terms of the environment, if we're not even asking questions or we don't even think about our interactions and connections with the environment, then there is a potential that we're going to be missing a huge amount. Whether or not we can come to X versus Y is kind of irrelevant. We're not even including that into our examples. And part of the reason why some of this is, and this comes to my work at the Children's Environmental Health Clinic too, where we look at toxicants and environmental exposures, positive or negative, climate change, et cetera. There's a lot of different reasons for that. I mean, part of it is that, what you're exposed to and the outcome, it's not usually linear. There could be a delay in time. So maybe you have one exposure as a child, and then later on another exposure, which can, come out. Maybe it's not really intuitive. You might get a rash after you touch, I don't know, a hamburger, and so the thought is, oh, the hamburger gave me the rash, but perhaps it's not. Perhaps it's another exposure that you can't see. And this is the same as we think about, like, what are the health effects of extreme heat? It's kind of obvious or intuitive if people come in heat stroke, but is it as intuitive that people might also present with increased rates of pneumonia, heart attack, stroke, aggression, violence, etc.? There's sometimes a delay in generations as this manifests or continue to manifest. It's not intuitive, and there's a huge lack of evidence. And so this is where I just give a plug to environmental medicine. Like in 2022, there was a study done, and they estimated there was about 350,000 chemicals and chemical mixes on the market. And we know that over the last few decades, especially in the early around 2010, Europe, but mainly in the US and Canada, the regulations for introducing new chemicals into the market changed and loosened up. And so in the US, there is a pathway where certain chemicals can be approved without any evidence of human testing. And in Canada, if they're approved in the US, they can flow forward here. And then even in Canada, and for even in the US where there is a lot of human testing, often it's done by industry sponsored, because it's just too much, right, to do independently. And none of these, because there's just so much every year, and then on top of it, a lot of these are not going to include long-term health effects. There's just so much we don't know. And with all the complexity of this, the lack of evidence, because some of this is so unique, right? So acute arsenic poisoning in a baby is one thing. Chronic arsenic poisoning can give you a complete different manifestation. And some of this is subtle. So how do you tease these things apart? And so this involves some real thinking. And I think part of it, number one, is X versus Y, right? X versus Y. That's how we think. The first thing that I think of now is invite ourselves to be curious. And I think a lot of people in the community, family, they're being curious. And then they're coming into the healthcare sector and they're not getting that concern validated, and we often dismiss it without knowing. And so just leaning in and being curious is very helpful. And how do you do that within our scientific principle, right? Because a lot of the time it's like, prove that this is bad for me. But that's really hard. So the first thing is, if we ground it and we reverse it, instead we ask, how can this be good for us? Right? That's getting to the precautionary principle. It still requires you to be scientific, but you're starting from a place of safety. And so yes, sustainability, how is this relevant? Well, gosh, like a lot of the things that we're actually prescribing patients, even in the hospital, whether it's a medicine or even creams. When my father was hospitalized, my mother looked at the moisturizing cream that he was given, and it included products that 20% of women are allergic to. And so she brought that to the manager, and they said, "Oh gosh, I can't believe it." But there's a lot of this happening, interacting all the time, and I think it's also how we approach this. How can this be good for us? So when we're talking to our colleagues, and inviting that alternative when you're talking about planetary health and why it's important, this is a really important framing. The other piece is these ecological health, which I'm sure you've seen. They have individual and these increasing relationships that we have outside of ourselves with our family, community, society, and down to our cellular level. There's a lot of different things that affect our health. And so this is another way of looking at it. The problem ecological models of health is that the physical environments are on the outside, so climate change, et cetera. And I always found this a little bit, there was something a little bit, it just felt too far for me, and I couldn't quite figure out why. And then I listened to Nicole Redvers, Dr. Redvers talking once, and she was talking about, where do you live? Do you know what the source of your water is? And she was talking to students in London, where the water is piped in from Lake Huron, and I live right by a river. I have a well. And so, and she made the point of, from an Indigenous lens, how do we understand in a colonial way that the river has life and we have a relationship with. And again, by this is all me and my understanding and rephrasing. And she talks about, well, if you drink that water for a period of time, how long, does it take your cells to regenerate or replace themselves? A few days, 3 months, 7 months, depending on the cells. So within a short period of time, our cells are going to be made up and composed of the molecules that are in that river. We are going to become that river, as well as we excrete that water as well. We're going to have this relationship with the river around us. And this was a very fundamental understanding for me, because if you think about it, the air that we breathe, the food that we eat, the water that we drink, what touches our skin, those are the most personal of environments to us. And if we go back to this, the air that we breathe is determined by who we are, our economics, where we live, our race, our so many different other factors around us control those personal environments, our access to food, our access to safe foods, etc. And so this is where if we put this and similarly, there's this mind body relationship that we have, and we know that there's a connection now. People, at least on a conceptual level, understand that the environment, our personal environment, also affects our mental health. The air that we breathe affects, exposure to air pollution. It has been shown to be associated with youth onset schizophrenia. It also affects our physical health. It's also associated with uh, heart disease and stroke. So there's this connection. So mind, body, environment connection. And if we think about this in the social determinants as well, we know there's epigenetics, that trauma, physical or emotional trauma can affect your epigenetics. And so what I offer you too from this model is if there is a mind-body connection, if there's a mind-body environment connection, because that becomes part of us and who we are, then wouldn't, from a colonial perspective, that wouldn't harm to our personal environments and our connections to the environment and the land that we're on. Wouldn't that also be a conceptual model about how trauma can be inflicted by, something that is seen as outwards to ourselves, like to the land, to the air, to the violence, to trees, the nature around us? This also provides a model where this might become, I say might as I don't have evidence to produce it, but for me, my understanding becomes conceptually validating as well of what we already know from what people report and experience. So that's mind body environment connection. The good news is though, like we didn't evolve as a species for the environment to be unhealthy for us. In fact, it's fundamentally good for us. And this is where I will go very quickly. And this is the land-based healing, nature for healing program that we started. So I'm going to let Nicole Yanni now talk about land-based healing.
Annie, hello. My name is Nicole Yanni. I am a registered social worker and member of Fishing Lake First Nation. I'm Soto. And today I'm going to talk to you about land-based healing and the land as the foundation of Indigenous identity. So you're going to look at this art image here, and you're going to see a few key details, which really tell a story. And so as you look at the art by Annette Sullivan, she's a Métis elder, and take in what you see. Look at what you notice. What are some of the details that are standing out for you? What does this art mean?
And this is where you could put your answers in the chat as well. But Nicole often think of lines of circle and connection and keep this art in your mind, and she will continue.
Annie, hello, my name. All right, if interconnectedness and the relationship with the land, the animals, the insects, as a people, from elders to our young people, you can learn how that is all interwoven, all interconnected to one another. And that's really important when we understand land-based healing. We also need to look at the relationship between the Crown and Indigenous people over the last few centuries. Our creation story starts with the relationship with the land. This connection is central to intergenerational healing. As an Anishinaabe in my home community, we gather for seasonal and annual and cultural events, language revitalization, ceremony, hunting and gathering, traditional teachings. All of these things, all of these gatherings help us care for ourselves and reconnect us to who we are, our identity, and our ancestral knowledge. The enforcement of the Indian Act impacted Indigenous people. in my Treaty 4 territory, out of necessity, our chief signed these treaties to save our nation from starvation. Our way of life was interconnected with the buffalo. Our survival depended on the buffalo. The desecration of millions of buffalo led to the signings of treaties for land use and allyship with settlers. However, the Crown understood this merely as a surrender of traditional territory. We were promised, as a result of this treaty, the highest level of education, cows and plows for farming, medicine boxes, bullets and ammunition, flour, sugar, a $5 treaty annuity payment, but many of these promises were broken. We were given the bare minimum of a yearly $5, with the laws restricting our movement to small areas of land that were also unfarmable reserves. They dictated our governing system, our cultural practice, and really the intended support didn't happen. The Indian Act also enforced the residential school system. Many young children, including my own parents, grandparents, and great grandparents, were taken away from their homes as young children. They were beaten for speaking their Soto language and were subjected to emotional, physical, and sexual abuse. They survived assimilation. They survived physically, but the emotional harm and memories are a reminder of what they have had to overcome and also have had to learn who they are. And that is through land based healing. So, as an act of reconciliation, it's important to understand how land based healing and its connection to overall health and wellness is central for Indigenous peoples. Community and healing and identity are just mere components of the whole picture, right? It is our responsibility to really understand the treaties and the land, and also on how this relationship evolved and how it impacted, but also how, as a nation, we are in this moment of revitalizing who we are as a people. So when we embrace the land, we come back to ourselves by nature. And this is a universal knowledge understood by many nations across Aki, which means earth, right? So we all individually have a relationship with the land. We're all stewards of the land. It is our responsibility to look after the earth because the earth looks after us, right? It gives us nabi, which is water. It gives us food. It gives us shelter, everything that we need, right? And as a helper that I get to work with Indigenous populations, help our young people, our families and elders, I have learned a theme in which many of us find solace in connecting with the land. And it's hard to even feel overwhelmed when we're on the land because we look at the tree line, we look at the sky, the water, we feel Aki beneath our feet. I'm looking out the window right now and I can see all of that. And I just know that I'm a big part of a bigger plan, right? And so I know that we're all a part of the land and that it keeps us alive. And so when we return to the land, we're really returning to who we are. And this is not something I've learned just on my own. This is knowledge that has been passed down to me from elders before me and knowledge keepers, right? And so this is something that is what we're talking about today when we talk about land-based healing and nature for healing. We're really trying to bring that connection back. All right, Miigwech.
Thank you, Nicole. And I love hearing her speak. And I think this is where, too, as we have been growing this idea of the mind, body, environment connection, it's really essentially become the mind, body, environment, and spirit. And this is as a pediatric ICU doctor, right? As when we think of these conventional eggs of health, a topic that we often don't talk about is healing. And that has been the incredible journey that we've been on together, which started in the hospital and went elsewhere. And I realize I don't have a ton of time right now, so I'm going to move forward quickly, but I'm happy to talk about this at any time. But the ideas are, this is Dr. Abitunga, who's a pediatric, she was a pediatric resident, she's now doing a fellowship, and slides she made. Because, at the end of the day, there's this wealth of knowledge about how nature impacts our physical, mental, emotional, spiritual health. It's just absolutely overwhelming. And to give you a few examples, one is there was a study done in the 1980s that they had two cohorts of patients that had the same surgery, so gallbladder extraction, and they were admitted to hospital after. The only difference between the two groups essentially was one had a view of nature, which they wrote in the paper like a tree. So they maybe could see a tree out of the window. It was a very low bar. The other ones could see other buildings or just the room in front of them. Those that had a view of nature had lower self-reported pain score. So they said they had less pain. The nurses rated them as having less pain. They used less opioids and they left hospital sooner. They had a shorter length of stay. So if that isn't a fundamental signal that there's something intangible through this that is absolutely, and whether it's the we know that stress and healing. So is it stress healing and that it impacts stress? But I think there's also something a little bit more profound there and interconnected that we know from studies that have looked at, your immune function when exposed to different trees and forests for a different period of time, that you have more protective inflammatory style cells. This is Nicole Struthers, another Nicole, a PhD and physio student that we have a pleasure to working with. She did this systematic review and meta-analysis only looking at physical health conditions. We're nature-based interventions. So some of it might be forest bathing, you sit in forest for a long time, but some of them were literally, okay, you have people who are just going on a treadmill or going on a treadmill looking at images of nature. They're going to like walk around, or they're in a regular area, going to walk around somewhere where you can see trees or in a park. So some of them were quite low bar, or exercise with a plant in the room, or even a fake plant in the room. And what she found across, and only removing mental health from the picture, people with arthritis had less pain, people with hypertension had lower diastolic blood pressures, people with diabetes had less glycemic control. There were inflammatory bowel disease, gastrointestinal, like a whole wealth. And overall, even if it was small, there was a positive to this exposure to nature, even in a small way. And so this is the meta-analysis from this. And so it was including like the 6-minute walk test for someone with respiratory issues. So they were looking at like biomarkers, right? And then this is from mental health perspective. There are so many studies talking about loneliness. That's really important. People feel more socially connected if they're in an area of green space, if not loneliness as well, how it can be used to potentiate interventions for anxiety and mental health, as well as anxiety, depression, ADHD symptomology. If you even have in a playground like a little bit of greenery, it decreases the rates of aggression, bullying. You have more children who are moving, more pro-social attention. If people live near some green space, they have a lower BMI, it's sustained. Like it goes on and on and on. I think the most powerful, to give an excerpt of this though, is that this is a meta-analysis used for horticultural therapy, which is growing things essentially for people with schizophrenia. And so it had often, with schizophrenia, there's they're called the positive symptoms, in the sense that hallucinations and active hallucinations, which had an effect of, but there's also what we call the negative symptoms, or which are essentially all the issues with quality of life, depression, functioning, social functioning, etc., which nothing has touched. And so overall effect on symptoms, the horticultural therapy was positive. It was positive for rehabilitation outcomes. And then just for the non-hospitalized patients, social functioning, quality of life, unequivocally, it had a positive experience. And so this is the first intervention that's ever improved that. And from a lens of, I invite you to look at this paper. We don't have time now to go through this, but this is again by Dr. Nicole Revers. When the Parks Program prescribing was going to come to North West Heritage, she thought, that's interesting. There's a lot of providers who are non-Indigenous, and a lot of, how are people going to be feeling about this, physicians as well as elders? How is this going to be accepted? And there's also no parks, like really, it's the land. What are you going to do? So she did a qualitative study. And in terms of physical physician perspectives, the cultural context matters. There was a lot of concern about how is it going to come across as I'm prescribing to people who have this concept of nature and land-based healing that's embedded in, for many, not causing assumptions, but this knowledge is much more, prevalent, and this is where they are the teachers and knowledge keepers, other than yourself as a Western positioner. Some of the barriers, including winter and other aspects that could be there. And then Indigenous elders' perspectives talked about, and I will leave you to read their narratives because I don't want to paraphrase, but ultimately, if it's done the right way. And also someone also said, it can be a rest from modern life. It's a way of life, and that we should probably be prescribing to you, the doctors. And there was another elder who also, I remember Nicole counting, saying that, this is work that they're telling, that they're trying to get their youth to engage in. So if you as a physician are supporting that and bringing that up and engaging in this conversation, they felt like it would, in a collaborative way, it might even help them in how in their influence and invitation of their youth to come back to the land and traditional ways. And also the comment about food is part of this. So we embarked on this program that's been going on for about 4 years now, and essentially we asked people what they thought about the impact of nature connections in the hospital. Unequivocally, people talked about physical, mental, emotional health benefits, and that there would be barriers would be around the actually doing it. And the Youth Advisory Board has been a big stakeholder in all of this, who again continuously were saying this. And they often said, they have illness experience or their sibling has had illness experience, and they say our parents might not even understand this, but why we need this. So we ultimately started out with this program, and we have a few different issues. So we had implementation surveys and qualitative interviews. We have ongoing feedback, and we also have this. We've been prescribing nature and building more spaces and areas to connect with nature. And we have this website open to everyone. We're sharing resources, even other people create it. We put it together, and we have this big team. And ultimately, the way we're prescribing nature, how do you do it? This is the why. I often say there's a lot of emotional, physical, mental health, spiritual reasons why you connect with nature. What do you think? And I have not yet. Inpatients, outpatients, parents whose child's in the hospital. I have not had one family yet who's looked at me blankly. They often have a lot of knowledge, experience, and then often it's this relational piece. I get deeper into the understanding of how their actual experience is and how they're doing than just asking, how are you doing? And this is where you also then give a little bit of literature to support that. What and where. So what fits in your time schedule? We're not so strict on what it is. Let's start with where you are in the vein of other social prescribing. How are you going to do it? Indoor and outdoor connections. So we prescribe connections. So it's, go outside and use your five senses. We have meditations indoors that are available online that we provide for them. Look at a book. If you're going to do coloring, use it nature themes and explain why. So there's a lot of different ways that you can integrate. Go to a window and notice the weather. And then the key to this is follow-up, right? So having something written down and a prescription, this dialogue that fits within them. We have hand dates around different connections, and then you follow up and see how it went. As this is all going on, and we did 2 years and a few studies where we co-designed this with youth providers, family members, and practitioners, what we realized when we're doing this form of nature prescribing is it really fits with all of these other concepts of social prescribing. But, physical health, whatever the health goals are, rest, sleep, emotional mindfulness, if you just integrate a nature connection into that, that's how we're prescribing nature. And this fits with the literature too. You're on a treadmill, look at nature's images of nature. That will have a benefit. So that's how our model has changed somewhat. We do have this toolkit that's available. We're just finishing it to fully release. And what this does is it helps people go through, if you're interested in this as a provider, to actually get you going. We'll also have a module on this, conversations about how to talk to your families about this, what they want, this dialogue. Some different ways that you can motivate this that's grounded in the literature around motivations. And we also have a sample prescription. And this is just some examples of all the different things that we've done. We don't have a lot of money. We got some funding from a Children's Foundation, and we have prints that go up on walls. We have a connection with a local art collaborative who lends us the London Arts Collaborative, who lends us paintings for a year, and then they take them down and we get another set of paintings for the next year. We also are doing lots of work collaborating with different groups around all sorts of different programming as well. And all of this work, I think, grounded in what my perspectives around, at least what I've learned about decolonization around this work and planetary health in general. So collaboration and communication involves us to have our own personal experience, emotions, and belief. And this is where, if we go back to our emotions at the beginning, if you're not well, if you're not in a good space, you can't engage with this. If you're listening to someone or me and you're like, oh God, I'm tuning out, this girl's too whatever, the adjectives you want to use, that's information. Can you lean into it? Be open-minded. Humility, entrepreneurial spirit. That's where research fails us sometimes in this. We have to try something, innovate, adapt, and then keep going through. And non-linear thinking, also opening multiple ways of knowing, because one impact has, there's many different ways, and then also privilege to power. So we all have privilege. So look at where you are, what you do, and how to enable that in terms of that is power, and how are you going to do it. So starting this all back together when you're thinking about how I now think about sustainability work is, first of all, we need our grounding principles in terms of what I see are decolonizing principles about who I need to be and who my collaborators are and how we need to work. And then we're using a green lens to things that are already happening around us, whether it's patient care or the things around us. And then there's some guidelines and requirements. And then if we're talking about health or healthcare or hospital, so the communities, our individual health, our environmental health are all going to affect us. And then there's also going to be these climate environmental risks around us. And then we're standing there when we're thinking about what I'm going to do in the vein of mitigation or adaptation, whether it's general QI work, like people washing hands, versus something environmentally grounded. On each of these levels, you can focus on individual patient level or your own well-being or the hospital and health system. And that's how I think about this. And going from the tree upwards to ground this in is we need to have our grounding first. We need to have ourselves and we need to be well, and we need to make sure that we are giving others an opportunity to be well, especially if you're land defenders or people who are working in social justice, anti-racism work, where it can definitely impact your work, your wellness. Look at what you're doing. Where do you have participate? That's your power. And then reaching out to the many networks, which is where the Coalition of Green Healthcare obviously fosters this. And then we have the environmental influences around us and all of the roots and all the community that we're connected with. And then you can pick a pathway in an area. But with this, even this concept of it, even the image being grounded in nature is something that I've come to use because of honestly my frustration in terms of our ability to actually do something, to speak out and also move things forward. And I think personally, part of my fundamental belief now is that how hard it was for me to think about the environment. I had my degree and I talked about the environment and relations, social determinants, anti-racism all the time. And then I went to medicine and they were very separate. And even for that consciousness, it's really hard to integrate because it hasn't been defined there at a fundamental level. Anyway, I know this was long. I'm going to cut through there, but happy to take questions and talk to anyone else about any of these other resources at any time. Thank you.
Thank you so much, Dr. Anna Guns, for a very informative presentation. And I think, judging by all the amazing comments, that everyone really appreciates your thoroughness and all the experience and personal connection you have to this presentation and this topic. It definitely showed, and I think we can all appreciate that a lot. And now I'm going to open up the floor to any questions. If anyone wants to drop the questions in the chat or in the Q&A function. And we have the next few minutes here if you want to try to get through some questions.
And I have to say, I'm reading all these things and I'm loving this. Yeah, I think, and the reason I know it seems like, well, this isn't a sustainability project. And I think it's like, I've been involved in a lot of them, but they're really hard. And I work in a culture that's very change resistant. And I've worked at the national level in the pediatric floors, also in the Royal College and the Academy of Pediatrics, at so many different levels around education. And I think this is where now I come to is I think we need to sort of own this and understand this to make it more intuitive for people as we go because it isn't so. And so we always see it as an extra and an or. So I don't know how helpful this is for people who are already in this line, but certainly this is how I now talk to leaders and been a really profound way that I've shifted my perspective and grateful to those with Indigenous knowledge and Indigenous systems who for this is much more.
We do have one question here from
yes.
Lauren.
So sick kids and sustainability, and this is what I'm trying to promote to find out the biggest boundary, infection control. Yeah. So it's interesting. So I have we haven't actually. So I think that from a lot of the time, people approach this or through QI initiatives. If you have a committee, infection control has to sit there. And I think this is where we have a phenomenal facilities group here, environmental specialists who are just phenomenal, right? And who know this and understand this. But there's a kind of a disconnect between them and the clinical world. And so at some hospitals, they've done great jobs at being able to create this connection and kinship. Whereas in others, it's been a bit more disconnected. And that includes my hospital here. So what I found from infection control at the different committees with our Nature for Healing, talking about bringing plants in hospitals in areas where people aren't immunocompromised, or with some of our plant health and sustainability work, I think and certainly my colleague who's run this whole OR program, Julie Strakowski, even getting bags, like getting people to bring their own bags instead of plastic bags in the OR for their clothes. It can be a big boundary. I think what was really helpful for me is to understand their framework is essentially it's about liability. And the other piece that I found really interesting is there's very little literature actually that grounds the recommendations. They have become increasingly conservative because of this, but it's not necessarily grounded in the literature. So having a good relationship, for example, with the person who works in our plant-based thing and looking at the actual literature for whatever it is that you're trying to intervene from the get-go. For example, for live plants, we know it can't go in these areas. Have we seen literature where live plants actually translates into effect in non-immunocompromised places? No. Soil does aerosolize some fungus around it, but does that translate into illness? There actually isn't literature. So what we did is, as we move through this and right from the get-go, because there are also plants in open spaces in hospitals, is going, let's pilot it. Let's work with you, infection control. They've given us permission to pilot it in certain areas, and we'll monitor the effects. And I think we have to take that, from the get-go. And I think also information sharing is also really important. The other place where the infection control literature looks, I think, a little bit misleading anyway, is, single-use products are often said to be better than the 30-time multiple use ones in terms of infection control. But there's been countless studies, including one by Coalition of Green Healthcare, right, with PPE and gowns, to show that that's actually not the case. In fact, there's been more studies that have shown issues with sterilization in the single-use ones. So I think bringing some of this literature in, depending on what it is, right from the get-go, and having a table that involves, like, our structure for our planetary health committee, if we could eventually one day have this approved, is co-led by an Indigenous leader with directors from different parts of the hospital, with our facilities green team person there as a leader, across the other areas. With we have a representative from the city, we have a representative from the community, all sitting there together to guide these things, having our everyone in the hospital feed up information and the asks, and then actually embedding it across all of these areas. And where a little study needs to be done is great. And I think this is where the Coalition for Green Healthcare and Cascades have also, they're aware of what other people are doing in some of the literature. So a quick ask there can also really enable that work. But you're right, it is a barrier. But again, I would challenge, what's the literature? What do we know and what we don't know? Because a lot of it isn't actually grounded in literature. It's about liability. And so hospitals that have a better time have a less of a high risk culture. We have a very conservative risk culture at London Health Sciences. It's very, very, very cautious. And if you read the newspaper, you can probably guess why. If you haven't, read about it. It's really exciting scandals. Um,
Yes. So I think
I
we're
don't know.
running right up to the clock here on
Oh,
time. But again, I really appreciate you for taking the time over the past hour to give a really informative presentation. And yeah, I'd like to thank you for your time. And again, the recording will be sent out to everyone to rewatch if they have any more questions. And you have your contact information there for you to reach out if you have any other questions. But thank you again for everyone for attending. And yeah, we look forward to seeing you at the next webinar. Take
thank
care,
you, everyone.
everyone.
I
Bye.
look forward to connecting to you. Bye bye.